Good afternoon, everyone. My name is Jamie Davis, and I have been a nurse since 2009. I have worked in the hospice field for about 7 years now, and today I want to tell you what hospice is, who qualifies for hospice, and how it works. First, I want to start by asking you this. What do you think of when you hear the word hospice? In my experience, many people relate hospice to death and dying. Hospice is about so much more than that. Hospice is about living. It is about providing our patients and their families with the best quality of life while they're nearing the end of their life's journey. Hospice goals are to provide education, emotional and spiritual support, as well as comfort and symptom management. Hospice teams are made up of a team of physicians, nurses, certified hospice aides, medical social workers, chaplains, and trained volunteers to ensure the company provides the support and care that patients deserve. Hospice also provides 4 levels of care: routine home care, which is routine care provided in the patient's home, wherever that may be; continuous care, which is continual care that's provided to patients who have uncontrolled symptoms or are nearing the end of their life's journey; general inpatient care, which usually takes place in a hospital setting; and respite care. Respite care is provided to patients' caregivers as a temporary relief or for emergent situations. How this works is hospice agencies will contract with facilities and place patients there for up to 5 days each benefit period so that it allows the caregivers to have a break, or it allows the hospice team to ensure that they find the patients a safe environment to return to. Hospice is a patient centered care available to those with life limiting illnesses. As hospice workers, it is our goal for patients to experience the dignity, respect, and compassion they deserve during their hospice journey. That leads me to who qualifies for hospice. To elect hospice, a person must meet a certain criteria that is set by Medicare. Medicare guidelines state that a patient must be certified as terminally ill by a physician with a prognosis of 6 months or less if the disease runs its normal course. There are also a few other things that patients and families need to take into consideration prior to electing the hospice benefit. They need to they need to determine, are their goals appropriate and in line with the hospice philosophy. They must desire to seek comfort measures over curative and aggressive treatment. And having those conversations with the patients or your loved one is vitally important before coming onto hospice. The next thing that I want to talk about is how hospice works. Once the physician, caregivers, and patients decide that hospice is right for them, the patients will then make a referral to a hospice agency. Then a nurse or liaison will meet with the patients and caregivers to determine if it is a good fit for them and if this is what they really want to do. Okay? Once that is determined and the hospice benefit is elected, then a nurse will come out and eval and admit this patient. The patient then is assigned to a physician, a team of nurses, aides, social workers, and chaplains who will oversee their care. Keep in mind, hospice is available 24 hours a day, 7 days a week. However, there are standard visit frequencies that is set by hospice. Typically, the nurse visits are 2 times per week, up to 2 times per day, depending on what's going on with the patient. The aide visits are usually 3 times per week, and the social worker and chaplain visits are monthly and as needed. Keep in mind that each agency is different and everybody's policy varies. So I would recommend that you interview several different agencies prior to determining who the best fit for you and your loved one is. Okay? In conclusion, remember, hospice is a life enhancing support system that promotes the best possible quality of life for our patients and their families. It enables patients to remain in their home, wherever that may be. Okay, it can be in a facility, it can be in a home, an apartment, it doesn't matter. The team approach to care ensures that every aspect of patient care is addressed in order to meet the personalized goal of the patient. The last thing that I want to leave you with is, if you know someone or if you have a loved one that is needing hospice, please do your research. Contact different agencies within your area and do interviews with them. Ask them questions. There's another there is a great book that we have and we offer within our company for patients who are nearing the end of their life. It's called Gone From My Sight. It is by Barbara Cairns, and it is a really great book to have and that will help you through your hospice journey. But do your research, figure out what your goals are, how it aligns with the hospice philosophy, talk to your doctor, and then make the decision and do what is best for you. Hospice is a great benefit for patients and families who are needing support, and everybody deserves to have the support and care that they need in the most vulnerable time of their lives. Thank you.